When is the best time to freeze your eggs? Everybody asks that question, and I think the answer is it's different for everybody. In general, the short answer is we'd like you to freeze eggs before 35. If you're not going to have a baby before 35, in general, if you're healthy, your cycles are regular, you have no risk factors, we'd like you to freeze before age 35. The longer answer is you really have to individualize. And if you're asking this question, give yourself a pat on the back because you're watching this video now and you're getting yourself more informed. And I think that's the number one thing, is that not everybody should freeze their eggs. Freezing eggs can be great for some people and it's not the right choice for other people, but a lot of people are talking about it. And so the question keeps coming up, and I feel that you deserve to have a lot of information, very detailed information, like exactly how it's going to feel, how much it's going to cost, what does it mean for you, all of those things. And the only way you can really, really, truly make an informed decision is to talk to somebody who actually freezes eggs. Now, some people say, I don't want to go in and talk to a doctor. That feels like too much pressure. So, you can do a lot of research online, but ultimately I think if you're really interested and you think you might want to do it, you should talk to a doctor. Now, having said that, before you go in, you should make sure that you tell yourself you shouldn't feel pressured to freeze your eggs just because the doctor you're seeing is great at freezing eggs and they love freezing eggs and they want you to freeze your eggs and they think you're a great candidate doesn't necessarily mean it's right for you. So again, I think doing some research online, maybe talking to somebody who's been through it, but are all good things. But ultimately, you should go in and see a specialist, somebody who has a great reputation and somebody who's done a lot of egg freezing and somebody you're comfortable with. And always nice to get a recommendation from a friend. Resolve.org, resolve.org, is a great resource for getting a referral for a wonderful board-certified reproductive endocrinologist who's in your area, and that's a good place to start. So if you were coming to see me, I would say I'd love for you to freeze your eggs before you're 35. And I do see a lot of young women coming to see me way before then. And I don't think that's too early. Our medical system is traditionally based is a disease-based system. So a lot of people feel funny going in to see the doctor if they don't have a problem or if it's not time to get their procedure done. But I think being proactive and learning about egg freezing ahead of time is a great thing. In fact, there have been some studies showing that if we built this into the healthcare system, that if little girls and little boys kind of knew about their reproductive health, their bodies way ahead of time, then they could make informed, reasonable decisions for themselves instead of hearing a news article and having a panic attack and saying, oh my gosh, am I running out of time to have a baby? Should I run out and freeze my eggs? Is it like an egg freezing emergency? And I don't think that's a great feeling. So it's really nice seeing that a lot more young women are informed about their health and thinking about this and coming in to see me way ahead of time. And a lot of them come in to see me, we talk, we do an exam, we do testing, and then they leave and feel comfortable maybe not freezing their eggs and thinking about, well, I'm in a pretty good spot right now, but if things change or if a couple of years go by and I'm not where I want to be and I don't have a baby, I don't have a family, maybe I should think about freezing my eggs then. So common scenarios where people should freeze their eggs. Number one, it's standard of care for all women who have not finished their family or not sure they've finished their family, still reproductive age, to think about freezing their eggs before any type of cancer treatment. Cancer treatment can often damage your eggs, and this is true for men too, can damage your sperm. There's things like radiation and chemotherapy. They literally knock out your eggs and sperm. And so the American Society for Reproductive Medicine and the American Society for Clinical Oncology wants everybody to be informed about the option to consider freezing your eggs if you have a cancer diagnosis. Not everybody, it doesn't make sense for everybody to do it, but it makes sense for everybody to at least get some information about it. Even if you're not getting chemotherapy or radiation, the fact that most cancer patients need to get treated for their cancer and then wait until they're cancer-free for a few years means that you're automatically much older when that's done than when you started, and just age alone can dramatically impact your fertility. So it makes sense for everybody with that kind of diagnosis to think about whether or not they want to freeze their eggs. Anybody with medical issues, systemic medical issues that would cause a delay in you having your family, or might possibly directly impact your eggs or your general health, those people should think about maybe freezing their eggs. And again, there's not a one-size-fits-all solution for everybody, but I think, again, if you're thinking about it, this might mean you should come in and talk with a doctor. Everybody's delaying childbearing these days, and there's a little bit of controversy about why people are deciding in general. It's important. We feel in general as a society that people should get an education. They should graduate high school, go to college, maybe even consider grad school. And we know that the more education you have, the better your income. And also, interestingly, the longer you delay childbearing, the higher your average lifetime income is. So I think I've heard studies saying it's like $7,000 to $10,000 a year difference in your annual income for every year you delay childbearing. So probably that data makes me think that the gender wage gap, a lot of it is about childbearing, about the fact that women carry the babies and men don't carry the babies. So delayed childbearing is really, really common in society these days. And so I think egg freezing makes sense if you're delaying childbearing. A lot of people are delaying childbearing, not for career though. Interestingly, although a lot of people think that many people are delaying childbearing for career, a lot of people are delaying childbearing because they say they haven't been able to find the right person to settle down with, the right person to have a family with. So for whatever reason, delayed childbearing is really common, and as you get older, it becomes harder and harder to get pregnant, and it harder and harder to stay pregnant. Miscarriages go up, and things like Down syndrome, which are due to an extra chromosome, become more common, and that is, we think, the mechanism for why it becomes harder to get pregnant, harder to stay pregnant, and there are higher rates of chromosomal abnormalities like Down syndrome seen in people's pregnancies. It's all related to the age of the egg, that the eggs, the longer they are in your body, the more likely you are when you fertilize the egg to see an extra or missing chromosome in the embryo, and which is why freezing your eggs at a younger age seems to make a lot of sense and seems to be kind of an insurance policy to be able to say, it's not a guarantee. We don't have a 100% pregnancy rate for egg freezing, but if you freeze eggs when you're younger than 35 and you use them when you're older than 35, it does mean that your chances of having a healthy pregnancy seem to be improved, and your chances of having infertility seem to be decreased because you have those eggs. So it's not a guarantee of having a baby, but it does seem to be like a little bit of an insurance policy where you can maximize your chances of having a healthy pregnancy. Now, some people will freeze their eggs and they might never use their eggs, and freezing eggs does cost a lot of money and is currently in the United States often not covered by insurance. It can be thousands of dollars to freeze your eggs. Just to freeze one batch of eggs could be $5,000 to $10,000, and often patients do, or people do better if they freeze 2 or 3 batches of eggs. We feel like right now with our current pregnancy rates, at least at our program, at IRMS at St. Barnabas, freezing 18 to 21 eggs, we think is about a 90%, maybe a little bit more chance of having one healthy baby. Now it's possible you could have more than one healthy baby from that many eggs, but given the current pregnancy rates, we feel like that's about one healthy baby, because every 6 to 8 eggs gives us 1 to 2 really nice looking embryos or blastocysts, and each blastocyst is about a 40 to 50% live birth rate, typically. So, and obviously that changes depending upon your age. That number is going to be very different if you're over 40 versus if you're under 35. But on average, that's what we're seeing. And so if you do the math, that yields about a 90-something% pregnancy rate for about 18 to 21 eggs in the freezer. And on average, we see that each egg retrieval procedure, we're getting about 6 to 8 eggs on 4 to 8 eggs on average, or half a dozen eggs on average. So that means that a lot of people, to get 18 to 21 eggs, will need 2 to 3 retrievals. So when should you freeze your eggs? I still haven't answered your question, but in general, we'd like you to freeze your eggs before you're 35. Now, other conditions, like if you're a smoker, we want you to quit smoking, and you probably have less eggs than somebody who's a non-smoker. If you've had surgery on your ovaries, you probably have less eggs than somebody who hasn't had surgery on their ovaries. If you'd had abdominal or pelvic surgery, you probably have less eggs, or you might have less eggs than somebody who hasn't had those surgeries. If you have shorter cycles, like your cycles are closer together, like instead of being on the average of every 28 days, you have a period, and you're more like every 25 days or less than that, then you might have less eggs. If you have your period less often, like every 30 days, every 35 days, you might have more eggs than average. And that brings us to people who just don't really get their period. You, whether you're thinking about freezing your eggs or not, you probably should see a reproductive endocrinologist and get that, figure out why you're not getting your period on a regular basis, and are there any health implications for that, and should you be doing something about that to keep yourself healthy. And speaking of staying healthy, you can't turn back the clock by being healthy, but being healthy definitely still makes a difference. So the biological clock still keeps ticking in the eggs, and a healthy 40-year-old still has an increased risk for infertility and miscarriages, but a healthy 40-year-old is definitely much better off in terms of carrying a healthy pregnancy. So we do feel like being a healthy weight, getting regular exercise, getting good sleep, eating plenty of vegetables, avoiding sugar, all the things you know you're supposed to be doing to stay healthy, it's good for your eggs as well. So not just good for your general health, but also good for your eggs. Although we still can't turn back the clock. So what do we do when we see you? We talk with you. We find out about all these things, like, are you a smoker? Do you have any health conditions that could lead to higher risks of having reproductive issues? Do you have a family history of endometriosis? If you have a family history of endometriosis, your risk for having endometriosis is much higher than the general population, and endometriosis can definitely impact your fertility. Do you have a family history of polycystic ovarian syndrome? Polycystic ovarian syndrome is the most common hormonal or endocrinologic cause for irregular periods. Although you don't necessarily have to have irregular periods in order to have PCOS. But if you have a family history of PCOS, you have higher rates of infertility. You have extra eggs PCOS patients often have more eggs than average, but you have other fertility issues, and you should probably come in and be seen by a reproductive endocrinologist. Do you have his family history of premature ovarian failure or premature menopause? That makes your risk for premature menopause higher. So when you come in to talk to me, we'll talk about all those things. Do you have those risk factors? Are there things in your life or in your family history, or in your personal history, or personal medical history that are going on that can affect your eggs? And then we talk about the process of egg freezing. We'll tell you about the pricing for egg freezing. We'll do a full exam, heart, lungs, breast exam, vaginal ultrasound, take a look at the ovaries. Looking at the ovaries, being able to look at your ovaries in person gives me some idea of how you'll respond to medications. We'll do something called an AMH level, anti-Mullerian hormone level, and that will help me figure out how many eggs you have. Now, a lot of people think that because IVF and egg freezing technology is so advanced, that I can tell you a lot about your eggs. But in reality, the testing that we do really can only say a couple things. It can say, oh, you're average for your age, you're above average for your age, or you're below average for your age. And the most predictive factor for egg freezing is age. So we can, without even meeting you or talking with you or anything like that, I can predict how good your eggs are just from your age. And that's why we say, think about freezing your eggs before age 35. Anyway, I've been talking for a really long time. Hope this has been helpful to you in terms of your thinking about egg freezing. Again, we'd love to see you come in and talk, and good for you for being proactive about your health. Have a great day. Bye.